Now we are dealing with the pancreas. I call it the hidden organ. We are going to scan the whole organ with all of its structures. So we have to deal with the anatomy, the normal findings, and we'll proceed to diseases affecting the whole organ, which means diffuse diseases, and then we take a look on focal lesions. I'm going to tell you how I got familiar with the pancreas in my medical career. When I studied the anatomical structures and the anatomical figures, there was no problem. We can easily detect the pancreas over here, and we can see the common bile duct. There is the liver with the left liver lobe, which is quite near to the corpus of the pancreas, and also the gas-filled duodenum over here. And it's also easy to name the parts of the pancreas. We can see the head of the pancreas, the body, and the tail. So it's a really hidden organ. It's behind the stomach and even posterior to the gas-filled intestine. So I've got it, the pancreas with its head, body, and tail. But this was theory, and the problem was this. In this ultrasound examination picture, I did not find the pancreas at all. When I started scanning the patient, I had no idea what to find and where to find. So I asked my colleagues to help me, and they showed me something over here, and I said, okay, fine. I thought, no chance. But then I got the first information what the problem is. There is no distinct echogenicity of this organ. In younger patients, it's darker, which means hypoechoic. In older ones, it's hyperechoic, means bright on the screen. And sometimes not even this is true. So a really hidden organ. We learn to scan the pancreas in a transverse epigastric view. But that's of no use when you don't know what and where to find the structures. So I went to the radiologists and begged for help. Show me where the pancreas is. And they were really nice to me and showed me an MRI of the upper abdomen. I was flashed. It was so easy to find the pancreas on this screen. A lovely picture of the pancreas, the head, the body, and the tail, and even processus uncinnatus over here. It looks like a croissant or a polywog, which lays over the lumbar vertebra over here. And when we take a closer look, lovely picture of the pancreas, head, body, tail. Very easy. I asked for the pancreatic duct, and this was also no problem on MRI. So this was day one of my final breakthrough scanning the pancreas. I stopped to scan for the pancreas. I started scanning for the landmark we will see now for the splenic vein. The splenic vein drains blood from the spleen to the confluence with the veins from the bowel and is in contact with the posterior border of the pancreas. So that is the way to find the pancreas. Now I'm going to show you all the landmarks and guiding structures, first on MRI, then using ultrasound. Over here we see the splenic vein, and this is the pancreas. Anterior to the splenic vein we see the pancreatic tissue, so we managed to find the pancreas. Over here we see the IVC, oval-shaped. In this area we find the stomach. Over there we see left liver lobe, the spleen in this region, abdominal aorta, superior mesenteric artery, and the left kidney in this region. With this information from MRI, I went to the ultrasound machine and tried it once more. Now, on the screen of our ultrasound machine, we first identify the guiding vessel, the splenic vein. There it is. We see the IVC, the abdominal aorta, and the superior mesenteric artery over here. And then we can see left liver lobe, and use as an acoustic window in this case. And that's the pancreas. Very clearly seen when you know what to look for. Whereas the pancreatic duct, its normal size is 2 to 3 millimeters in younger patients. You can get a glimpse on it over here, I think. Only in this region I have an idea where the pancreatic duct is. So once again, next patient. Another echogenicity of the organ and slightly other angle of viewing, and we have to look for the landmark. Where is the splenic vein? It's over here. So where is IVC? Here. Abdominal aorta. Somewhere over there SMA, superior mesenteric artery. And there's the pancreas. This is the pancreas. Maybe an older patient with an increased echogenicity. And once again, this was the picture I've shown you at first. Our guiding structure, splenic vein, IVC, abdominal aorta, pancreatic duct, and pancreas. This was my learning curve when I started doing ultrasound examinations. Now, we have a really good view on this pancreas, on our hidden organ. Keep in mind that the tail of the pancreas can be even greater sometimes than the head of the pancreas, and it's regularly wider than the corpus is. So we have measurements. The head is about 3 centimeters in diameter, body about 2 centimeters, and the tail can be up to 3 centimeters. The pancreatic duct measures 2 to 3 millimeters in younger patients and become up to 5 millimeters in older ones. The first one begins in a transverse plane in the upper abdomen. And the hint is not to look for the pancreas, look for the splenic vein. So I put the probe over here, ask the patient to inhale deeply, please, and move downwards the transducer very slowly to find this structure over here.
Here's the splenic vein.
The beginning of the splenic vein, but I want to get the whole vein into our view.
No, really beautiful.
Fine. So we can detect the splenic vein over here. And I think it looks like a polywog.
Yes, or like a dolphin.
Of course. And the whole tissue, superficial to the splenic vein, is pancreatic tissue. So we can identify the head of the pancreas, the body of the pancreas, in between the neck, and some parts of the tail of pancreas over here. There's another view we can use. It's the longitudinal view, but it's not so easy to detect pancreas over here. But it's also fine to find the guiding structures, and the first guiding structure in this case is the abdominal aorta. So let's go for it. We scan in the midline and try to find this tubular structure, abdominal aorta. It's a video clip, I show you. Here, abdominal aorta and its branches, celiac trunk over here, and superior mesenteric artery over here. And then we remember the SMA was quite close to the pancreas. So we can use this as a guiding structure. And the SMA was posterior to the pancreas in the transverse plane. So we have to look for the pancreas superior to this artery. And when the artery is over here, this area is the area where we expect the pancreas. You can also see this tiny structure over here. It's also echo-free. It's a vessel. Do you guess what this structure is? It's the splenic vein in cross-section. So the landmarks in longitudinal plane are abdominal aorta, SMA, and maybe splenic vein if seen. So we can find pancreas in the longitudinal scan. Check once the transverse view. We see abdominal aorta, SMA, splenic vein, and in the longitudinal scan, aorta, over here, SMA, and over here, the pancreas. I know it's not so easy, but when you keep in mind what we have seen in transverse plane, it's getting more easy, I think. We have got another opportunity to scan the tail of the pancreas. We are looking for the splenic vein in the hilum of the spleen, and pancreas is located lateral to this vessel. So we scan in a left lateral position in between the ribs in an intercostal space and scan the spleen, its vessels, and when we got the splenic vein, we see pancreatic tissue beside. So I'll take this away and you see pancreatic tissue over here by scanning from a left lateral position. Showing you this over here. In the sonographic finding, we see the spleen over here. There are the vessels of the spleen, which means the splenic vein is located here. And this tissue is pancreatic tissue. So, measured over here, splenic vein and the tail of the pancreas. To get the full view on the tail of the pancreas, we have to change to a lateral view. So, nearly the same maneuver we use to find the spleen.
Ah, I can see already the spleen over here.
So I place the probe in between the ribs, in the intercostal space over here. Try to find the splenic vein again. Take a deep breath, please.
Can be difficult sometimes.
And now we can see here splenic vein from the helium of the spleen. And this tissue over here is pancreatic tissue, the tail of the pancreas.
Really looks like a tail, doesn't it?
So these two planes are used to make a full examination of the pancreas. Now we have seen different ways to find the pancreas. But the most important information is search for the splenic vein and you will find the pancreas. This is the main landmark you have to look for.
Now let's go for the pancreas. I place my transducer in a transverse epigastric view. Move it slowly, caudally, and search for the splenic vein.
Ooh, very lovely picture of the splenic vein, abdominal aorta, IVC, and over here, all of this tissue is pancreas, from head, body, to the tail of the pancreas.
We want to see more of the pancreas tail. So I place my transducer in the left lateral intercostal space. Display the spleen.
Spleen over here.
And
There's the splenic vein.
inhale, please.
Fill stomach. And over here it is.
Ah, I see something else.
But first we go for the pancreas.
Okay.
Pancreas over here. The same echogenicity than we have seen before. The tail of the pancreas, splenic vein. You mentioned this structure over here?
Yes.
An accessory spleen in the hilum of the spleen.
Beautiful. Well, this was easy now. But what do we do when it's more difficult? For example, when there's metabolism or obese patients. We got a few tips and tricks for these cases.
So the first hint, we are going to scan from a very cranial position. So we are more superior to the stomach and the gas in it. And use the left liver lobe as an acoustic window. Please take a deep breath. Inhale. So we see the left liver lobe. And now I tilt the probe downwards. And even now we can see splenic vein over here. I freeze the picture. The splenic vein. And all this is pancreas. Head of the pancreas, body of the pancreas over here.
This is my favorite approach.
Mine too. So we avoid the gas in the stomach by scanning from cranial. But we can try to do it the other way around, to place the probe downwards in the mid of the abdomen and tilt the probe upwards to find the splenic vein and pancreas. And we ask the patient to inhale once again. But in this particular situation, we do not succeed and can't find the pancreas.
As you can see, not every approach is suitable for every patient. A glass of water. How can a glass of water help us in this case?
The main problem now is gas in the stomach. So we want to replace it with water by drinking a glass of water. The best way to do is to use a drinking straw. So please, take a glass of water.
And don't use carbonated water, obviously.
And don't use the water directly from the water pipe, because there would be gas bubbles injected into the liquid. So fine, you have to hurry.
Thanks.
We go on with the scan. Take in a deep breath, please. So we can detect a lot of water in the stomach. Over here. And now we have even a chance to find pancreas inferior to the stomach. Over here. The body of the pancreas, splenic vein, and the head of the pancreas once again. So we managed it only by using one glass of water.
And the neat thing is, if we do this a few times, it is also much easier to find the urinary bladder.
Sonography of the pancreas is not as difficult as I thought in the beginning of my career.